Hello, this is Dr. Lewerenz, Longevity Health Institute. Hey, what's in the doctor's bag? Well, I promise you today, what I'm going to bring you and talk to you about briefly here is some things in the doctor's bag, Dr. Lorenz's bag, that are not stethoscopes, are not otoscopes, or any type of scope, but things that can bring you the best in functionality and help you. And no, I'm not getting paid to say and endorse and talk about these things, okay? In fact, I may even get some messaging saying, please stop by these companies, but I'm saying all positive, good things to them. So I want to tell you what's in my doctor bag that can really help you. So please share this and use these things, because when I share them with patients here, because of ailments, chronic conditions, prevention, helping them, it's really done wonders. And these are not things just new. I've been using some of these devices and these tools for literally up to 10 years. So simply a couple things. So one is this, okay? And it's a product. Maybe a lot of you here heard about it or know about it, the Hoka shoe, okay? This company, this brand is a lovely, wonderful brand of shoe, mostly tennis shoe, mostly active wear type of shoe. But the structure of it, the make of it, this is my wife's. Yeah, they make some cool ones. These are actually mine. You can see I get some wear and tear by running around and working out in them. But Hoka shoes, this company, this brand, has really done big strides in helping things that help with compression of the spine and knees and hips and back and all that, okay? And yes, I'm 53, but I can tell you in my mid 40s and on, started noticing big things with whether it is a running motion, a jumping motion, a sport or activity that just I hurt more, okay? And we call it in medicine axial loading, meaning, you know, this up and down movement, okay? And a lot of sports and staying healthy and being active is gonna require you to have some axial loading, okay? Whether it's on elliptical, whether it's running, whether it's, you know, some exercises in the gym, whether it's tennis or a sport or what have you. And, you know, a shoe like this that has a lot of compression, has a structure that has a bigger sole, a bigger base here for a bigger heel strike, has been proven scientifically, and I can tell you here clinically and personal use, really help out with joint issues, spine issues, hip issues, knee issues. So remember, and I've said this if you're my patient, when you're talking about longevity and about staying healthy and doing all this prevention, you gotta live and outlive your spine, your structure. And that's the hardest thing to overcome. If we are on point on everything with hormones and nutrients and toxins and detoxifying and diet and genetics we're on top of, and we're on top of everything, okay, and you got a bad structure, you're gonna have a lot of wear and tear in your body and not be a happy person with aging. That's not gonna be delicate, articulate type of aging. You're gonna be in pain and be really compromised because of structural issues. Hoka, I believe, is a great thing for prevention. And if you have pain, it has helped a lot. It's helped me a lot with some chronic on and off pain issues just because of using that type of shoe. The other thing is, and I love this thing, this is not new, by the way. This is not, Hoka I think's been out for about at least 7 to 10 years. This is not you. This is called a Theracane, okay? You can look these all up online in that, a Theracane. This device kind of looks like a torture piece of equipment here, or something you could abuse somebody with, or you know, I don't know, maybe you could hang a pot from, you know. But this is a great tool. You can YouTube this or look on their website, Theracane. That's Theracane, like it's a cane. These are great and have great pressure points for point massage, pinpoint things that you often can't touch and reach, unless you have a partner or going to get a professional massage or something like that. And it's great because you can use leverage with these things to really get into trigger points and muscle tenderness and all that. I personally love this for traps, neck, occipital area, and the lower back, because again, you can use it and work with it in using your own muscle, your own strength to massage and get these trigger points. I've used this literally probably for 10 years. Of course, prior to using this, I would heat your body, get some heat on it, get some hot shower, you know, do some stretching, things like this, get the muscles loose. But if you deal with chronic muscle spasm, tightness, post-exercise, you know, you get some, you know, muscle tension in that, wake up with a stiff neck or that, heat it up. Theracane, I believe, is awesome. Again, there's many tutorial videos on YouTube and on their site about how to appropriately and properly use the Theracane, but I can tell you got many patients using that, okay? Since we're talking a lot about structural spine pain, recovery stuff, when you're talking about exercise and that, one of the hardest things you have to deal with graceful aging and staying in shape and staying active, like I try to do myself, okay, is recovery. And whether that's recovery of your adrenals, whether that's recovery of, muscle tissue or joint tissue or inflammation in the body, it doesn't happen as quickly as when you're in your 20s and 30s. I can promise you, okay, whether you think so or not. This is a device, and there's many ones like this. I've had this for years, okay, a Hypervolt. It's a compressive device here. It does these, small oscillating shock waves, okay? Different speeds, different attachment of devices and that. And you can use these on, self-use these, or if you have a partner that is, you trust to use these on your back or what have you. These are great, man. I love these post-exercise, post-workout. I'll go on a mountain bike ride. I'll do a spin. I'll lift some weights, whatever. I play hockey still. Old man, I call it beer league hockey. But when your body hurts and the muscles hurt, not joints, muscles, and you're trying to move lactic acid, get blood flowing in and out of there, and then I use this often pre-stretching because it gets blood flow and moving. I even know that when I use my professional masseuse on and off, she uses this to warm up your back and warm up the muscles before she gets into some deeper massage. But the Hypervolt and many devices like these oscillating massage devices, and there's a bunch of different settings, so you don't have to use it to a setting where you're gonna hurt yourself, but these can really, really help and get into tissue and help recovery a lot, because a lot of that recovery I was talking about is just not going to happen as quickly. And if you can get blood flow and lymphatics flowing and circulating much better and much quicker, you're going to have a quicker time to heal and recover and much faster. Another device in the doctor's bag, at least Dr. Lewerenz's bag, is, I think you've heard me talk about this before in either one of my videos in YouTube or on Instagram, and that is an Oura ring. I've used this Oura ring. I pseudo use it as my wedding ring. I have a real wedding ring. My wife knows this. I keep it at home, safe and tight and, pristine. But this, I just wear it as a wedding ring, and it's got electrodes, pickups here on the inside if you can't really see that. And Oura ring, look it up with an O, it starts with O, O-U-R-A. Oura rings are wonderful for many, many, many metrics that you can follow for your overall health, okay? I like this because the newer versions, the Gen 3s of these, okay, you can check your oxygenation when you're sleeping, helps a lot with sleep data, which helps with recovery and knowing if you're getting appropriate and proper sleep. It looks at heart rate variability, calories burned, all that. Now, the downside to Oura rings is it's not in real time, which I'm going to talk about a heart rate monitor that I've used for years and years, literally like 20 years when training and exercising, and especially anything aerobic. But I love the Oura ring for many tools on my day-to-day or week-to-week, and just kind of checking in about your sleep and recovery. And I modify exercise and workout based on that. But the Oura ring is worth, I think it's about $3.99. I think don't quote me on that, but the Oura ring is wonderful. I have many patients use this. There's many devices out like it. I love this. It's got a lot of reliability, and I've been using it for years and years. The other thing was, and this is real-time heart rate stuff, because you got to use reliable companies and things that are not gimmicks. Yeah, albeit they might be a little bit more money, but this is my Polar Strap heart rate monitor, okay? I personally like this, yet it goes right to my phone, syncs right to your phone. It's real time. So when you're doing HIIT training, or you're doing, like this weekend, I was out mountain biking at Stony Creek Park here, beautiful fall October day. It was unbelievable weather. And, I like to know how many calories I burn, where's my max heart rate, where have I been at. It's just my nerdy, metric tracking stuff I like to do. But the point being is that you're not going to get that in real time on any of these, even on watches and even on straps, in that And these are in real time. And what I mean by that is you're not getting a delay at all. Okay, you can look at your phone, you can look at, you can wear a watch with the puller strap. You can get it instantaneously, so you know, because heart-to-heart variability and heartbeats when you're doing HIIT and you're doing things like this, you know, you don't want to delay or any interference, and it's going to throw you off in tracking. So I like this. I actually even wear it playing hockey, ironically, in that beer league, old man hockey, I call it, because I just like to know how many calories I burn, what kind of workout I got, you know, if I need more recovery the next day, because wow, my heart rate was really high during that session, during that skate. So I love this. And again, after hockey, I'll use the Hypervolt. Sometimes I'll use a Theracane the next day, you know, because albeit it may seem like something silly, like an old man has to use to recover, but you know what? I want to stay fit, healthy, and active. You know, you move. If you don't move it, you lose it. Okay, motion's lotion. Yet you ache and hurt. You can always fight against that, and it's always worked well for me. You always have to learn and adapt and grow. Remember that. One last thing is this, and it's about mood stuff, attention, focus stuff. This is a new device I've used about the last year. It's called a Mendi, M-E-N-D-I. This device is really interesting because it does, and it works on a basis that is very supported by Stanford, Princeton University, by NASA, by aerospace technology, but it's neurofeedback, okay? And there's a lot of studies going on with this type of device, this Mendi device, but it works on, you'll wear this, by the way, and I'll tell you how it works, but it works on functional near infrared technology in therapy, where it's picking up blood flow, because again, you wear it on your forehead here, okay? It's picking up on blood flow, and it gets synced with your phone, and there's a neurofeedback type of videos that you watch, and you do some activities, and it is meant for things with focus, attention, anxiety, some mood stuff in that. I found it helpful, especially with things like focus and slight anxiety, or that kind of, if you will, pre-game anxiety. You know, fortunately, I don't deal with a lot of generalized anxiety, but when you got a lot on your plate and you're juggling a lot of things like family and business and friends and travel and fun and love and blah, 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 I call it all these plates spinning, you know, you can get a little bit out of balance. Point being is something like that, I use my smart device, my cell phone, helps bring me into focus. Actually, I only do it a couple times a week. In sessions like that, they recommend. It's really interesting. Look up the technology at least, and I feel like it's very worthwhile, and it's helped me personally, Mendi. So hopefully this is very insightful. I don't want to be too windy, but these are things that literally for at least a decade or more in some of these things that I've used personally. They're in my doctor bag, if you will, or my longevity thriving bag, and you may find benefits from them too. This is Dr. Lewerenz. Be well.